Okay, welcome again to another video of the getting acquainted with the use of CBCT and how can we navigate through the different views and windows. So last time we have gone through the axial view, and in this view or in this video we're going to navigate through the tangential view. Unlike the axial view, actually tangential view is not as wide in coverage as the axial view, because that's why you have to choose in advance which area you want to see. So, and this is accomplished actually through the use of the slicing window. So we will go through let's say the teeth, and I will try to maximize the window of the sagittal plane zoom out so that we can have an idea at least where we are and when it comes to navigation. Okay. I'll try to start for the most lateral part. As you can see in here, I am at the outer. Let me go back to the. Okay. Here I am in the. I'm trying to cover the largest portion. I'll just increase the size of this window. Okay, so I will start from the most lateral part excuse me, of the mandible and the maxilla, and I will try to navigate from the most lateral, as you can see here, going medially to the other end. Okay, so this is the shadow of the ear over here, external earlobe, and this is the external auditory meatus over here. Here you will see the articular fossa and the articular eminence. Of course, we are in the right maxillary, on the right side of the skull, and this is the condyle, and we will go here. This is the neck of the condyle. This is the sigmoid notch. Okay. I will try to go in a. This is the farthest that I can go in a lateral direction. This is the farthest side I can go in the coverage, and then I will go in a medial direction. You see, I'm going medially now. I'm going in a medial direction. Now we have gone through the mandible, as you can see in here. This is the ramus, and this is the angle of the mandible, and you can see in here we started from the mandibular foramen, which appears very big. We started to see the inferior dental canal. Okay, this is the inferior border of the mandible. Then I will go again more medially. Okay, see, when I'm going here in these areas, you don't expect to see everything as you would have seen in the axial view. Here you have to choose in advance which area you want to see. So if I pass by the angle of the mandible, now I am exactly in the inferior dental canal, as you can see in here, where I can see a combination of the condyle, sigmoid, but I don't see the coronoid, and I will see also the part of the maxilla, part of the maxillary sinus, and part of the temporal bone over here, and the teeth which are present. If I take you back to the other view, see, we are in this region. Okay, let me give you an example of how to trace the inferior dental canal. For instance, I will take the cursor to the inferior dental canal. Okay, now I'm in the inferior dental canal from a lateral view. Let me just put it exactly. This is the inferior dental canal over here. Okay, while in the coronal view you can see it exactly. Let me remove this. You can see it. This is the canal. This is the inferior dental canal. If I click it here, you will find it on the sagittal view exactly on this direction. This is most similar to what you see in the OPG. However, in the OPG you cannot navigate through the whole thickness of the mandible. Now I'm going laterally, then I will go in a medial direction all the way. See, now I'm in the bone, in the middle of the bone, and I'm going more medial direction. Let me bring you closer to the teeth, and as you can see, I will go in a most medial direction. Then I will end up more in the middle. Let's see where we are now. See, we have gone into the floor of the mouth. This is the floor of the mouth, as you can see it in here. If I go back, if I want to go back to the center of the mandible, this is the center of the mandible in the posterior area. If I want to see the premolars, for instance, I will take you to the mental foramen. This is the mental foramen over here. Let me just choose it exactly. This is the mental foramen in the coronal view, and this is how it looks this is the mental foramen from a sagittal view. You can see this is the inferior dental canal over here, and then this is the mental foramen. If I go up, see, this is the loop, and then I lose track again. So I have to reposition myself. See, I went outside, I have to reposition myself back again. The idea here, unlike the sagittal, the axial view, those views actually they are more restricted, limited in their view. That's why I told you in the last video you better start with the axial view, because the axial view is the only view where you can go through the whole thickness of the images. Here you have to go layer or area by area. If you want, for instance, to go and see the upper molar, so this is how the upper molar appears, okay? And here's the maxillary sinus, the wall of the maxillary sinus over here, and you can see this grayish thickening on the maxillary sinus. This is the largest area of the maxillary sinus. I'll bring you back down. This is the largest area of the maxillary sinus over here. Here you can see the styloid process and the part of the middle cranial fossa is also appearing here. So I will start for the maximum thickness. I'll go to the maxillary sinus. This is the maximum thickness of the maxillary sinus. I will reduce again. Okay, so this is the maximum thickness. I'll take you up here. Okay, this is the largest width of the maxillary sinus. We can zoom in and zoom out. Okay, and then I will go medially. Now I'm in this is the meatus, this is the concha. Okay, how do I know? I will know from here. See, where did I go? And this is how it looks. Now if I go inside, as you can see here, inside I have gone into the nasal cavity. This is the inferior concha, and this is the middle concha over here. And if I go even more in the middle, this is the maximum coverage. You see that it's when I move, it stops. It doesn't go inward anymore. Just to get oriented, this is the palatal shelf over here. This is the soft palate. Okay, and this is, we are actually inside the nasal cavity. This is the sphenoidal sinus over here, and these are the atlas vertebra C1, C2, and C3. Okay, and this is the tongue over here, oropharynx, nasopharynx over here, and at this moment the tongue is closed. It's closing the oropharynx, as you can see in here. And this is the dorsum of the tongue. This is the shadow of air which is present between dorsum of the tongue and the palate. And here you can see the incisive canal and the incisive foramen. This is the tooth, central tooth, upper central, and this is the lower central, and this is the bite block where the patient is biting. lip, upper lip, lower lip, and part of the shadow, and these are the nasal bones over here. This is the maximum we can get in an this is the maximum we can get in the as we go medially. If we go more laterally, then we are here in the conchi, and then we go out. Now we start in the teeth, and then we will go in the level of the maxillary sinus. Let me take you down to the level of the teeth. In the level of teeth, you can see it as if you're seeing it like an OPG. However, the difference is, as we said, in the OPG you don't have the ability to navigate through the different thicknesses of the tissues. If you go to the other side, I will take you to the other sinus over here. Here we are in the midline. This is the midline. See, here we have to have some kind of understanding. Here it looks as if it is a coronal view. Actually, it's not a coronal view. We are looking here at the side of the patient. The best view to locate here is to have a look at the axial and the coronal views, if you want to the exact appearance. And then I will go back again to the other side. The other side is also we start from the most medial. I'll take you to the medial side. See, this is the inferior concha and the roof of the palate, or the palatal shelf, and inferior incisive canal. Same thing, but it is from the left side. Tongue, dorsum, and this is the palate over here. Of course, this is the atlas and the cervical vertebrae. If I go in a lateral direction, again I'm moving laterally. I skipped. Now I'm still in the palate. See, compare always. If you don't know where you are, you go and have a look at the coronal or the axial views, and then you go more laterally, lateral. Now you have reached the level of bone, as you can see in here. In the maxillary sinus, you don't see as clear as the other one, because you will have this kind of a dome-shaped radio opacity. It could be a thickening, it could be a polyp, it can't be a collection of fluid actually, because fluid actually does not take this curved, it goes in a more flat position. Anyway, we'll discuss this when we come to the diseases of the maxillary sinus and how it is seen in the radiograph. Okay, I'll go now more outwards. See this thickening over here. See how it looks on the coronal surface, and in the axial view it almost appears to be completely blocking the sinus at this level, but actually it doesn't go to this complete blocking. See the dome-shaped radio opacity of the sinus. It is more or less a thickening or a polyp. Anyway, I'll go more laterally as you've seen in the other view, and we have the exact thing on the other side, the coronoid, the condyle. I will take you to the coronoid. Hopefully we can see it over here. This is the coronoid process. This is the coronoid process. Okay? You can see it here. And this is the condyle. Coronoid, the condyle. So, as we said, the more you practice, the more you will have an idea about the appearance of the structures. See the inferior dental canal, how beautifully it is displayed on this image. See, you can trace it from here downwards where it goes. Let me see if we can get the mental foramen. Yep, this is the mental foramen over here. I'm using the mouse, left click, and I'm trying to navigate through the different structures or the different layers. This is the mental foramen. See how it looks from the coronal side, from the front, and see how it looks from the side. Okay, so again I'm going laterally. Let me take you to the level of teeth, and then we will go and see we are now on the floor of the mouth. Medially we have gone laterally, and we will end up here to the most maximum, or the most lateral side, where there is no more coverage of the